Hello students. Last time we studied about the aqueous humor dynamics, the production and the drainage of aqueous humor. So let's start about what is the dearrangements occurs if there is the excessive production or there is a resistance in the outflow of this aqueous humor. So what is glaucoma? So by definition, it is a group of disorders which is characterized by the progressive optic neuropathy, resulting characteristic optic disc changes, visual field defects, and frequently associated with raised IOP. So these three entities should be there to say a glaucoma. So whenever there is a raised IOP, so that leads to the optic disc changes. So parallelly it causes the visual field defects, and obviously there will be raised in the IOP. But in exceptional cases, there are entities called as low or normal tension glaucoma and ocular hypertension also. So what are these concepts? We'll discuss in later part. So what is the pathogenesis behind this? The glaucoma is. So as I told you, it is optic neuropathy. So it is a disease of the retinal nerve fibers. It is not to say it is a disease. The neuropathy is the changes that occurs because of the raised intraocular pressures. So what happens here? There will be a death of retinal ganglion cells, which is in a characteristic pattern that slowly results into the changes in the optic disc appearance, and that respectively, so depending upon which part of optic disc is involved and which part of retinal nerve ganglion cells death occurs, similarly the visual field defects will be there. The person will have the pattern of visual field defects. So actually when person is having the vision, he will not come to know, but when we go for the testing, we can make out what type of visual field defects are there in that person. So what happens whenever there is a raise in the intraocular pressure, there will be kinking of these retinal nerve fibers, and the very fine the arterioles or the vessels takes place. So that blocks the transport of these growth factors called as neurotrophins from the brain to retinal nerve ganglion. So there is a transfer. Normally, these are the neurotrophins which acts as the boosting or the energetic agents for the retinal ganglion cells. So whenever there is a raised pressure, there will be blockage of this transportation of these neurotrophins, and that's how it leads to the death of these retinal ganglion cells. So the process we call here it as apoptosis. Okay. Then what are the etiological factors, or what are the theories behind these? One is the mechanical theory and the one is the vascular insufficiency. The mechanical theory, as I told you, because raised intraocular pressure, there will be stretching of these nerve fibers, especially at the lamina crepullosa of optic disc. So there will be the axonal deformation takes place, and that leads to the ischemia, and that causes the altering in the capillary blood flow. That's why blockage of this supply of neurotrophins, those are the growth factors, and death of these cells. And the second one is vascular insufficiency. Again, the vascular perfusion of optic nerve itself is decreased, because even optic nerve head is richly supplied by this very minute vessels. So whenever there is raised pressure, the perfusion is also affected, and that leads to the failure of arterioregulatory mechanism of blood flow, vasospasm, and systemic hypertension, and again the death of these cells. And the other entity is called as secondary result, that is the excitotoxicity. These are because of neurological degeneration leads to the release of many toxic factors such as glutamate, oxygen free radicals, and the nitric acid, which further alters the functioning of these retinal ganglion cells and death of let's study the first part of glaucoma, that is the primary or congenital or the developmental. As the name itself indicates, congenital or developmental glaucoma means it is since birth or before the birth the child has this glaucoma entity. So the abnormal growth fact IOP is due to the anomaly of the angle of anterior chamber. So during the development itself, there is a deformity in the angle of the anterior chamber that causes the defect in the drainage of the aqueous and eventually leads to raise in the intraocular. So again, it has classified into three types. One is true congenital glaucoma, infantile glaucoma, and juvenile glaucoma. True congenital glaucoma is one where IOP is raised during the intrauterine life itself. When the baby is inside the uterus, that time only there is a raised intraocular pressure, and when the child is born, you can see the very big enlarged eyeballs. Whereas infantile glaucoma, yes, it starts manifest after the birth but before the third year of the child. So in 55% of cases you see such kind of glaucoma. And the third one is juvenile glaucoma, where it starts after the 3 years but before adulthood. So it is known as the primary juvenile primary open angle. So what is the pathogenesis of this congenital glaucoma? As I told you, there is an anomaly or there is a defect in the development of the trabecular network or the angle of the anterior chamber itself. So what we call it as a trabecular dysgenesis. Okay, it can be due to the root of the iris is directly attached to the angle of the anterior chamber, or there can be concave insertion of this root of the iris, or there will be defect or the membrane formation at the anterior chamber. So what are the clinical features of this glaucoma? So as the child is born with a very big eyes, so along with that, what happens, raised intraocular pressure in kids, it's very stretchable initial phase as the eyeball is growing. So that's why along with the other structures, the sclera is also stretched, the cornea also becomes large. So whatever the nerves, the corneal nerves are there, they get exposed directly. That's why the patient will have lot of photophobia as well as the corneal edema, because of stretching of the cornea, the descemet membrane is ruptured. So there will be gush of this aqueous humor into the corneal stroma that leads to the edema of the cornea, and that's why the cornea becomes hazy. So the patient will have lot of lacrimation, photophobia will be there. The patient just buries his head into the pillow. That is the feature of this congenital glaucoma is there. And just to avoid the light, he will be continuously blinking his eyes. That causes the blepharospasm. Okay. So the corneal enlargement will be there. So that's why we call it as a ophthalmos, and there are breaks in the descemet membrane, what we call it as the habstri, and the sclera, as it is stretched, the underlying the choroid is visible. So that's why it looks like a thin and blue. And the anterior chamber, obviously the corneal, the curvature is also increased. That's why the anterior chamber is deep, and because of the pressure, the atrophic patch is also seen, and sometimes there will be iridogenesis also, that is the loosening and the dancing iris you can see. The lens is flashed and stretched because of stretched zonules, and it makes it subluxated also. The optics disc is there will be cupping and atrophy you can see, and IOP is raised. Okay. This is how the eyes looks in case of ophthalmos. You can see the diameter of the horizontal and vertical diameter of the cornea, how it looks bluish, and even the sclera is looking very bluish color. Okay, but it is in the initial stage because still the edema is and all manifested in this case. So what is the treatment? The treatment is mainly is the surgical line of treatment only. So you have to go for the goniotomy. Goniotomy, there is a one small needle-like blade will be there where you are going through the gonioscope and just making a slit over the angle of the anterior chamber, that is a kind of called it as a goniotomy. Whereas trabeculectomy, again the puncturing of this trabecular meshwork, and the filtration surgery is where we are making the proper channel between the anterior and the posterior chamber by making opening at the trabecular meshwork. We call it as a trabeculectomy. Okay, so they can be combined. Trabeculotomy is just making the opening, whereas trabeculectomy is where the part of the trabecular meshwork you are excising. So these are the treatment of the congenital glaucoma. Okay, so for your this one homework, write in detail about the definition, the classification of the glaucoma, and write a short note on congenital development. Okay, in next class we'll study about the primary glaucoma.